Hey, Jules Plus Vegan, and as always, welcome to my channel. And for those of you who are new, I know you can benefit. So I was going to talk about cheese. I know. So interesting, and something I shouldn't be eating, and something that sadly I need to remind myself of the reasons I'm not eating cheese. But that said, I always share on topics that are important in the moment to my life. And just a moment ago, I got a call from my niece who said that she was on her way to emergency because they had discovered like 3 blood clots and in pretty important places, like under her arm. At first, they were thinking, oh no, is it cancer? And then as she was reading up on it, she was like, no, from what I see, I think it's blood clots. And they ended up doing some kind of scan, let's just say, because I don't know which one. And it turned out she had 3 blood clots. She has 2 girls, and they're special needs, and she had to arrange for them. And you know, a mom is always a mom, even in an emergency. And she insisted on leaving and ensuring that her girls had a place to go before going back to the hospital. God bless her, right? But she was crying and scared and on her way back to the hospital, and I'm a few hours away, but I said I will come, if you need me to. And I most certainly will, and I'll see how that plays out. But I just wanted to read a little bit about blood clots. I can't blame my Invisalign on everything, or just being tired as I'm tripping over my words. But thank you for your patience. Anyway, so I wanted to read about blood clots a little bit. In my life, my grandmother, and of course this is being an older person and by no means obese, had an aneurysm when she was older and actually survived it, unheard of, right? Her late 80s, early 90s, actually survived an aneurysm and was highly functioning after. What? Yeah, God's grace. My sister Teresa had blood clots, but it was related to pregnancy. Still super scary, and had to give birth a little early to save her own life. And praise God, her daughter lived. But my sister Vanessa ended up getting blood clots just a couple of years ago. And mostly for her, again, not obese, would be maybe living in higher elevation. She lives in Colorado. But my niece lives at the beach, so it's not an elevation thing. Her daughter is 5, so it's not a pregnancy thing. She may be slightly overweight, but not probably not even in the obese range, or maybe just pending. But something's going on. So prayers all around for my niece Chase, who just wants to be an amazing mother and ensure that her 5-year-old with Down syndrome has a quality life, And I'm just praying that God will double bless her for that alone, for the bravery of that alone. So let's read a little bit about blood clots. And this is familydoctor.org, which I'll include in the description of the video. So it reads, what are blood clots? Blood clots are differently sized clumps of blood that have formed inside your body. Clotting is important to prevent excessive bleeding if you are injured or cut. However, when a blood clot blocks blood flow to important areas of the body, it can be harmful and even deadly. Blood clots can occur in your arms and legs, abdomen, meaning the stomach, heart, lungs, brain, and kidneys. So in other words, like anywhere in your body, right? There are 2 different types of blood clots. These include clots that stay in place and don't move, which is thrombosis, and those that break away from the spot where they developed and move to different areas inside your body, which is an embolism. There was this beautiful girl, Michelle. We grew up with the family, and I was best friends with Raquel, her little sister. And it was so interesting. Michelle was 18. I'm not kidding you on how strikingly beautiful she was. And not just because I was a 5-year-old who admired her. She was beautiful. And all of a sudden she started talking about when she dies. And she was talking about the beautiful casket that she wanted. And she described a pink casket, and people were like, morbid much? Like, come on, girl. Within a week of describing her casket and her death, she had an embolism in her brain and died instantly. Wow, right? None of us ever got over it. I don't know how people can get over it, but anyway, Raquel turned out beautiful and forever missed your sister Michelle, whom I never stopped praying for. Okay, so depending on what the clot blocks or where it moves, a blood clot can be deadly. So here are some blood clot symptoms. Symptoms are different depending on where the blood clot is located. If the clot is in your arms or legs, you may experience pain. That feels like intense cramps. Chase just felt like a lump. And then when she went to the clinic, they were like, well, you have a lump and it seems to be following down a vein line, and we'll have to get it checked, because it could be cancer. And then somehow, and it just has to be God, when Chase was reading up on it, she was like, no, I just know this is a blood clot. And it turned out that she had 3. And I can't even think of where she said they were. I mean, I know that one's under her arm, and another one I think was in her arm, but I think another one was in her neck, which can be really, really scary. But God is bigger. I get that. So that can feel like an intense cramp. There can be swelling and tenderness. Your skin may be red and warm to the touch where the clot is located, and if the clot is in your abdomen, you may experience severe stomach pain, even vomiting and diarrhea. Blood clots that travel to your heart can cause a heavy feeling or pain in your chest and pain in your upper body, shortness of breath, sweating, nausea, and lightheadedness. If the clot moves to your lungs, you could experience sharp chest pain, a racing heart, shortness of breath, sweating, and fever. So interesting. You may cough up blood. A blood clot in the brain may cause weakness in your face, arms or legs, speech and vision difficulties, headache, and dizziness. Many of these symptoms are symptoms associated with other conditions, such as heart attack and stroke. What causes blood clots? Your body reacts to an injury or cut by clotting your blood just the way it should. These types of clots are not a problem. Sometimes a blood clot will form without a trigger, such as an injury or a cut. This is more likely to happen with certain risk factors or conditions. The risk factors include prolonged sitting, like often the case with travel, which is why you should wear like compression socks, right, when you travel, and you're forced to sit for long periods of time in an airplane, a train, or a car. Prolonged bed rest, often the case with surgery or illness, and they always give me those inflating socks and things when I have prolonged bed rest, which sadly I've had far too many times in my life. Pregnancy, smoking, obesity, birth control pills, hormone replacement therapy, and breast cancer medications. Certain cancer types like pancreatic, lung, multiple myeloma, or blood-related cancers. Trauma, like serious injury. Some types of major surgery. Age, especially over the age of 60, a family history of blood clots, autoimmune disorders, diseases related to chronic inflammation, and certain infections like HIV/AIDS, hepatitis C, or even Lyme disease. How are blood clots diagnosed? Whether you go to your doctor's office or an emergency room, the doctor will examine your symptoms. The doctor also will ask you about your medical history, your family's medical history, and the medicines you're taking. Now, I have no idea if my niece is on any medication. I have no idea. Granted, these are her aunts that are having, or her aunties. In California, we just say aunts. Don't confuse us with the bug. Hold on. Let me see what she said. My niece just wrote me back because I just offered to drive the 100 or so miles to her. I have to turn you guys sideways a second. I love you, and I will be okay and out soon, hopefully. Thank you so much. I know, that's her being humble. Part of me was like, just go, Juliana. But with the COVID and stuff, I don't even know if they would let me in, right? And of course, I'm a teacher, but I also know, like most McCances, she's scared and being overly brave. So I'm going to keep praying about that for a moment. But anyway, it's really hard now because we can't really rely on family history anymore, right? I mean, the way that our youth may not even live as long as our parents, the way our youth have fatty liver syndrome and they're 9 years old, stuff that used to only be attributed to like excessive drinkers and stuff, right? Because lifestyle has become so drastic, it's very hard to measure family history anymore. And in my case, only one family member got cancer, and he was, he was a drinker, he abused drugs. His lifestyle largely contributed to that early death. So that's a tricky one. But anyway, the doctor may order a blood test to send to the lab. A blood test can diagnose an autoimmune disorder or certain infections. The test involves inserting a small needle into a vein in your arm to draw a sample of blood, and there are several lab tests that can check for abnormal clotting and for a presence of antibodies that interfere with clotting. Can blood clots be prevented or avoided? Blood clots are highly preventable. Let's say that again. Blood clots are highly preventable. To prevent or avoid a blood clot, know your personal risk factors and control the risks you can. For example, if you smoke, stop. If you are obese, lose weight. If you take birth control pills, talk to your doctor about an effective alternative. If you are inactive, get moving. If you have a family history of blood clots, talk to your doctor. Like, as I'm saying all this, I'm thinking of my niece. She doesn't smoke. She's not on birth control. She walks every day and more than once because she walks her dog. She walks with her little daughter. So she gets a lot of walking in. I have a feeling that she drinks a little, maybe like a glass of wine here or there, whatever. It doesn't even mention alcohol here, but alcohol serves no one ever, right? I think they actually say alcohol helps with moving the blood. Hold on. Yeah, you know how you can find something to back any way of life that you want? So I just read something that said moderate use of alcohol can balance the amount of fat in the blood, contributing to proper blood circulation, which anyone who loves to drink would love to justify that. I say no to alcohol on every level, unless you're using it to clean something, right? Or like rubbing alcohol for your pierced ears. Otherwise, that's a no. Okay, so let's see. Your doctor may determine whether you should be taking blood thinning medicine to prevent clots. There are several situations in life that increase your risk for blood clots. That include pregnancy, being immobile, having major surgery, and when you have cancer. Blood clot treatment. A blood clot is treated based on where it is located. Oral blood thinner medicines are the most common treatments for blood clots. Some medicines can be given through a catheter, which is a long thin tube, inserted into the area of the clot, which will break it up right at the source. There's a risk in breaking it up though, right? Because it can let loose in your body. It's such a nightmare. Some clots can be surgically removed. Talk to your doctor if you're pregnant. Medicines may involve risk to your unborn child. If your blood clot is due to an infection, your doctor may be able to treat the infection and reduce the risk of blood clot. Living with blood clots, which is kind of my sister Vanessa's situation right now. Isn't that girl going through it? Are you kidding me? With her, what is it called? Guillain-Barré syndrome, the COVID, and blood clots. Like, wait, what? I mean, it doesn't matter that she was a beauty queen, that she's 5'11" and gorgeous, like, and totally handled in her life. When you have, like, as we know, when you have health problems, that is the focus, and prayer. If detected early, a blood clot can usually be treated successfully. If it was not treated early, your quality of life depends on the seriousness of the damage. For example, a blood clot can cause stroke and even death. If you've successfully survived a blood clot, you may live with the fear of having another. In that case, living with blood clots involves focusing on prevention. If you are being treated with blood thinner medicines, you have to be careful not to cut yourself, even when shaving. The medicine can make it difficult to stop the bleeding. Oh, so true. Poor Vanessa, she's so careful. She's one of those follows like the medical medium, drinks celery juice every single day. There's a lot of things she's done to improve her life. But yeah, these are just some things I'm so sorry that she's dealing with. She's only one kid ahead of me, right? Out of the 11. So I'm acutely connected to Vanessa and have even shared dreams with her and even felt her pain, almost like twins. So interesting. Okay, questions to ask your doctor. How can I tell the difference between symptoms of a blood clot and another condition? How much time does it usually take for a blood clot to travel to a danger zone once it breaks apart? Once a blood clot lets loose, like with an aneurysm, there is no time. Let's be fair. If you survive it, you're lucky, and often people are dead. Like, are you really going to try and time that? Prevention, my friends, right? If I have one of the risk factor diseases, conditions, should I be taking a blood thinner? How do I know if I need to see a doctor if I cut myself while taking blood thinner medications? Can a blood clot be passed through your urine or stool? Ooh, that's interesting. I'm not familiar at all. Additional references: American Society of Hematology on blood clots and the Center for Disease Control and Prevention, Understanding Blood Clots. All right, I just wanted to process that so I could be a little more informed on how I could support my niece. I am getting on prayer patrol right now. I have millions of prayer warriors to address, and I am going to get back to my niece right now. So prayers for my precious niece, Chase. She was born just before my 10th birthday, and she is just a joy and deserves to be well because, again, her greatest honor is to care for her daughters. All right, like if you like, join us if you haven't, subscribe. Let me know in the comments below if you know anything about blood clots, if it's your experience, if this was of interest to you. And until we talk again, prayers welcome, and know that you are blessed.